Let's look in depth at the etiology or causes, right? When you say etiology, it's like the origin, okay? Origin could also mean the causes, right? So etiology of lower gastrointestinal tract bleeding. Etiology of lower gastrointestinal tract bleeding. All right. So we have discussed the lower GI bleeding and we have discussed several disease conditions that could lead to lower GI bleeding, right? Diverticular disease, diverticulitis, sigmoiditis, proctitis, proctosigmoiditis, and the rest of them. Okay. So we get to look at the possible things that could cause, right? So it could be anatomical causes like diverticular disease, hemorrhoids, solitary rectal ulcers, and fissure in anus. It's basically having all those what fissures in the anus, right? It could be some vascular causes or vascular problems like what angiodysplasia, where you're having a dilated and tortuous blood vessel, right? This could lead to bleeding. It could be ischemic colitis, it could be rectal varices, it could be what Dieulafoy's lesions, right? It could be inflammatory conditions caused such as what inflammatory bowel disease, infective colitis, right? It could be some neoplastic causes like polyps or cancers in the lower gastrointestinal tract area. Okay, it could be other causes like what some systemic causes, that's if the person is having general bleeding disorders, right, where blood is not coagulating as it should. All right, general bleeding disorders could also bleed through the anus, right? It could be that the person is under some anticoagulant medications, right? So anticoagulant medications could also lead to this bleeding, right? It could be post polypectomy, that's after a surgery has been done to remove the polyps, right? The surgery done to remove the polyps is a what? Polypectomy. So post polypectomy is more of like after the surgery was done, there were some complications, right? It could be due to radiation colitis, where the person is having an inflammation of the colon due to a radiation therapy they are undergoing. Okay, so all this actually make up the possible causes or etiology of what lower gastrointestinal tract bleeding.